I am Julie Barron, and I'm a pelvic PT out in Bellevue, Washington, where I'm the director of the Pelvic Health and Performance Center. And I'm also the creator of this new course for Herman and Wallace called Pelvic Venous Disorders. So as PTs, we often deal with people who have chronic pain, chronic pelvic pain, complex diagnoses. And I think we could all acknowledge, if we look back on our careers, that there are always these patients that stay with us because we couldn't figure out what was going on. Maybe it was someone who came in with chronic pelvic pain, and no matter what you did, nothing helped. Or maybe they came in for prolapse management and it was just not responding in the way that you thought. And they ended up maybe leaving or discharging themselves. And you always wondered, what could I have done differently? And I've been in that position too. And then all of a sudden I became that patient myself. And it was because I developed what's now called pelvic venous disorders. And in the process of trying to navigate the healthcare system, convince healthcare providers that I was, being truthful about my pain, and, because you're gaslit so often, I realized that there's just like this missing hole in our curriculum as PTs and OTs. And when I went through that experience, got treatment, felt so much better, I just decided I needed to create a course and tell everybody about it so that they would not have the same experience I did. When we learn about pelvic congestion syndrome, we kind of learn that it impacts people from maybe the ages of like 25 to 40. And that still holds true for these classic presentations of PVD. But the reality is research is now showing that this isn't something that just resolves in menopause with changes in estrogen levels. It's actually something that can come about in menopause as well, which is totally different from what we've been taught. It can also affect people who have no pregnancy history, and it can affect people of all genders. And so I think what's great about this course is we get a chance to kind of break down all of those presentations so you can feel really confident in screening everyone for it. The first part is self-paced, and what we do is we kind of break down the pathophysiology of pelvic venous disorders, which had previously been known as something like pelvic congestion syndrome, for instance. And then we talk about the evolution of our language around venous disorders. So kind of asking people to interrogate their feelings about using terms like pelvic congestion syndrome, because people have a lot of feelings about it when you tell them, actually, you know what, we're not going to call it that anymore, and here's why. So as we learn more, as the research kind of starts to come out, our language should sort of reflect those changes. And so we kind of discuss that in the course as well. We go through assessments, diagnoses, treatments, how to collaborate with other providers. And it's kind of like a clinical roadmap for people. I believe it's from 8 to 3. It's one day. We're going to go through, we'll kind of review some of the self-paced content that is done before the class. Okay. And then we're going to have a lot of just back and forth questions, lab portions to kind of practice and really get comfortable with the comprehensive assessment and treatment. Initially, when we learn about it, if we learn about pelvic congestion syndrome, we don't see it as something that is necessarily treatable. We don't see it as something that we can immediately that day have impact on necessarily. And ultimately, this course will hopefully help empower providers to really educate their patients and help them get what they need, because this is way more common than I think anyone ever realized. It's 30% of all chronic pelvic pain cases. One of the biggest risk factors is pregnancy. So if you're working with people who have any kind of history of pregnancy ever, or they have chronic pelvic pain, I mean, this course is for you.